Within a year, I'd completely reversed all of my chronic disease.
Amazing.
All of them. Autoimmune disease. I was a really successful surgeon. I went to zero to go practice functional medicine. So it was a scary time. Part of becoming the boss of your own biology is being empowered to know what your biomarkers are. Biomarkers change 20 to 30 years before you get a disease. And you have to keep them not just normal, you have to keep them optimized.
What are some of the most and least reliable biomarkers you're using to assess longevity?
Some of the most reliable ones are going to be the ones that lead to the most problems. And those are
Hello and welcome back to the Vibrant Wellness Podcast. I'm Dr. Emmie Brown here with Melissa Gentile. Today we're talking about the longevity revolution. Many of us wonder, what if we could take charge of our health before symptoms ever appeared? For this episode, we're diving into the cutting-edge world of proactive health optimization and longevity solutions with one of the industry's leading experts. Dr. Darshan Shah is a health and wellness specialist, well-known board-certified surgeon, published author, tech entrepreneur, and founder and CEO of NexHealth. As an expert on all body systems, he has performed over 10,000 surgical procedures, including trauma surgery, general surgery, and plastic and reconstructive procedures. As a health and wellness specialist, he has advised thousands of patients on how to optimize their well-being and extend their lifespan, culminating in the creation of NexHealth, the first health optimization and longevity center to offer life-extending and enhancing technology and treatments in a beautiful, welcoming environment. We can't wait to learn more about the latest longevity science with Dr. Shah. Thank you so much for being here, Dr. Shah.
Thank you for having me.
Absolutely. So I have to ask, to kick us off, what sparked the shift from surgeon to longevity trailblazer?
There's a few things that kind of happened all at the same time. One was that I was working really hard as a surgeon. I operated almost every single day of the week, even Saturdays and Sundays. I was operating usually about somewhere at a minimum of 8 hours, but normally it became a 12-hour day. And when you work like that, just standing, being sedentary, surgery stressful, I was eating the garbage that the nurses bring and put in the nurses' lounge, donuts and fast food. I wasn't sleeping well, and I was just really always functioning at a really high cortisol level, And so the combination of all those things, as you can imagine, I'm painting the picture, I got really sick myself. I was 40 years old, and I had the biological age of like a 60-year-old. I had diabetes, I had high blood pressure, which is uncontrolled. I had an autoimmune disease. And worse than that, I just felt horrible. I couldn't move well. I had joint aches and pains, and I was, 50 pounds overweight. So it was hard for me to really function the way I wanted to. And I never exercised as well. And so I got really sick. And at the same time, I'm a little bit of an older dad. I had my first child when I was 42 years old. And so, like many of us, when we have a life-changing experience, like having a child, you take a good hard look in the mirror and you just say, like, what am I doing? And there was a stark realization that I had at that moment in time that at the rate that I was going, I might not be alive to see my son graduate from like college or get married and all those things that I want to be there for. And so I decided I wanted to kind of turn this whole situation around. Now, being a highly trained Western medical doctor, I did multiple residencies in surgery. I also worked in the emergency room, urgent cares. I trained at the Mayo Clinic, one of the foremost institutions in this country. I had absolutely no idea what to do. And so, doctors in medical school and even beyond, you don't get trained in the science of nutrition and the science of sleep or exercise at all. And you're at a real disadvantage. You're really good at diagnosing disease and taking care of disease, but not in the science of getting healthy. And so I took some time off and I went down some of the educational paths that you both went down. I learned about nutrition science. I learned about the science of exercise. I actually got a personal training certification and a nutrition certification. And in that world of back then, this was 10 years ago, people were talking about how they were also learning about the root causes of disease and functional medicine. And this is where, some of the leaders like Jeffrey Bland and Dr. Hyman, who are now close friends, they just started conferences on functional medicine. And I went to these conferences and my mind was blown. And I said to myself, this is how I'm going to get healthy. And so I did all the things, literally everything they recommended. I did. I took care of my gut health, my hormones. I completely changed my diet. I detoxified my lifestyle. And within months, I started feeling better. And within a year, I'd completely reversed all of my chronic disease, all of
Amazing.
them.
Wow.
Autoimmune disease. My doctors were astounded. They thought I'd be on, immune suppressive medication for the rest of my life.
Wow.
And I was headed towards getting on insulin. It was crazy. And I had nothing left except for one blood pressure medication. And so at that moment, 12 months after my journey started, and my son was about a year old, I called my office and I said, stop booking surgery for me. I'm going to practice. This is the kind of medicine I want to practice. And so I completely changed and I opened a little office in West Hollywood to start practicing functional medicine. And, there was kind of like a transition period where I was still doing surgery because I still had stuff on the calendar that was booked, had to pay the bills. I was a really successful surgeon. I was making millions of dollars every year. I went to zero to go practice functional medicine. So it was a scary time, but I did it. And now, it spoke to people in West Hollywood and Los Angeles, and we ended up growing really quickly. Now we have locations all over the country, and we're opening 80 locations all over the world of my new clinic called NexHealth. And it really just came from a passion of, getting myself healthy and then wanting to see my patients experience the same thing. A lot of my surgical patients that were booked for surgery, I actually started telling them what I was doing, and they ended up canceling their surgery because they
Oh my
didn't need
God.
it anymore.
I love that. I just want
Yeah,
to, woo, that's
yeah,
amazing.
exactly.
Doing
So I
it from
kind
the
of shot myself
rooftop.
in the foot as far as like practicing Western medicine and surgery go. But
Mhm.
it was a great kind of career shift, and that's the whole story.
Yeah, I love how you highlighted how you had to take a large risk as well. You had a very substantial career, and you're like, hey, I basically gave it up to start something that I can really stand behind. So I love that, and thank you for sharing the full story. So now that you're in the work that you do now, I mean, what was the experience like going from trying to save people's lives with surgery compared to what you do now with optimizing health for your patients? Like, how has that workload affected you, and how does that experience feel?
Well, what's beautiful about what we do in functional medicine and also nutrition and exercise science, everyone that works in this field of creating health, is that it's much more scalable. And so what I see is that I'm able to, instead of doing one surgery at a time and maxing out at maybe 5 or 8 a day, I'm able to spread this message to hundreds and thousands of people. I do a lot of speaking engagements. I'm at a lot of conferences. I do podcasts. I have courses online. I do so many things to spread this wellness advice. And what's fantastic about it is that I get emails from people I don't even know that have heard me speak and telling me that, I either changed their life or I saved their life or I inspired them to start really, turning their chronic disease around and feeling great again. And so I just feel like I'm still saving lives, but I'm able to do it at much more scale. And also, I feel that, when you're doing surgery, you're really just treating disease. You're not creating health. And treating disease is great. Like we need the Western medical system to treat disease, but it's just much more inspiring. It helps me get out of bed every morning to know that I'm creating health because it helps people avoid disease care, which is the ultimate goal.
Mhm. I want to know, Dr. Shaw, what can a patient expect at their first Next Health visit? And what does the intake process look like?
Yeah. So if you come to NexHealth, what you'll immediately notice is that it doesn't look like a doctor's office at all. It looks like we call the Apple Store of health and wellness. When you come in, it's beautiful, it's inspiring. I wanted to create basically what I did when I started the business is I sat down and I wrote down everything wrong with the healthcare system right now. And then I wrote down what is the opposite, right? And so one of the things I wrote down was no one wants to go to a doctor's office. It's not an inspiring place to be. It
Mhm.
feels like sickness and disease. I wanted to create a place that people want to go to. So it's a beautiful office and high ceilings. And, we really just start with our patients with a couple of mindset shifts. And what I mean by that is number one, we want them to know that health is not something that you do once a year on an annual physical with a doctor. It's something that you interact with on a routine basis. So we have equipment that people can use as part of a membership on a weekly basis and treatments they can do on a weekly basis. Secondly, we want to empower people to become the boss of their own biology. Another way to say that is the CEO of their own health. And we do that by testing a bunch of blood work on them and also not just blood work, but also we do other biomarkers, like we put them on a in-body scale. We measure urine tests. We do strength grip test measurements. We do their metabolic rate. And we do all these measurements because part of becoming the boss of your own biology is being empowered to know what your biomarkers are. So we measure these things and we give them to the patient and we explain what each biomarker means. And so that's how we start off the relationship, is empowering them with their biomarkers. And then we measure them on a more frequent basis, either quarterly or every 6 months, depending on what you decide to do. And we sit down with a doctor who's functional medicine trained to review those biomarkers. And then we pair everyone with an expert in nutrition and health coaching as well, so that they have not just the doctor's perspective, but someone to also guide them on a more frequent basis on exactly what they should do personalized for their results.
And that's half of it too, the interpretation of the labs, because we've all been to the conventional doctor's office before and we get labs run and the doctor says, "Oh, all your labs are great and everything's in the green zone." But it's like, what's determining those green zones or those okay zones? And when is something actually optimized versus just kind of in an okay range?
Yeah, I mean, most doctors are trained to look at that sheet of blood work, right?
Mhm.
And if it's not red or have an H next to it, they say everything is fine.
Mhm. Mhm.
In reality, we all know this is that biomarkers change 20 to 30 years before you get a disease.
Mhm.
And you have to keep them not just normal, you have to keep them optimized, right? And so it's really important to have that mindset around biomarkers when you're testing them. And most doctors don't. Doctors are taught to diagnose disease. You diagnose a disease when a biomarker is abnormal. And by then, it's often you need a medication or you need a surgery, right? And so that's kind of what we're taught in medical school. And so it's really not the right way to be looking at biomarkers. The right way to be looking at them for health is to keep them optimal.
Mm. I'd love to know what informs your optimal ranges, because I think that they change depending on the expert and the provider you're speaking to. And obviously, we want to look at evidence based information here. So, to guide some of the practitioners listening out there, where should they refer to for optimal ranges for routine blood work, say?
That's a really great question. So I go to the experts. I look at what Dr. Hyman recommends, Dr. Jeffrey Bland, Casey Means, all of the doctors that we know that are luminaries in their field. We talk about this stuff all the time. We're all good friends. Um, and we don't just use what the lab tells us. This is really important.
Mm.
We use what the lab tells us combined with our clinical knowledge of what we see in our practice, combined with what's working individually for each individual patient.
Mhm.
And so I think it's always really helpful to understand that these numbers that are considered normal ranges were determined by measuring many people and finding the average, right?
Mhm.
And we know average implies that there's going to be a bell shaped curve and there's going to be people that fall outside the average. And so you have to keep that in mind with every single patient. It really, your care and especially your interpretation of biomarkers needs to be individualized.
Also, I don't think anyone here wants to be average,
Right.
even if we
Exactly.
are in line with them, right?
That's such a good point. So
Yeah.
true.
So kind of even going off of that, for patients who already eat well, they exercise, they're sleeping properly, they take good care of their health. What advanced strategies
can take their health optimization to the next level. Because I think a lot of people tuning in, they know how to avoid toxins, they know how to eat, a blood sugar balancing diet, they know how to prioritize sleep, but how much further can we go with some of the technologies that you guys have?
Great question, Melissa. So what I do is I have actually a structure around this. It's called the wellness wheel. And there are 12 aspects of wellness that we discuss with our patients. Those 12 aspects of wellness are divided up amongst 4 different goals. Goal number 1 is to get the basics right. So that's what you were talking about: nutrition, sleep, exercise. You have to get those fundamentals right by doing the right things at a consistent daily basis. Secondly, is we focus on how do we avoid death, to put it bluntly. And that really brings in some of the best diagnostic testing and thought processes in Western medicine, but brings them forward to before you get the disease, not waiting until you get the disease. So that's where we talk about optimizing your cardiac health, your brain health, and also your immune system so you avoid cancer and your metabolic health. Okay. Then once we have that all figured out and we've reduced your risk of death from metabolic disease, heart attacks, Alzheimer's, or other neurodegenerative conditions, and cancer, which are the 4 leading causes of death, then we can start really working on other aspects of your biology that functional medicine has really brought to the forefront. Some of the root causes of disease. So we can avoid all diseases altogether. And those are working on your hormonal health, your gut health, and your detoxification systems. All right. And then after we get all that right, kind of the pinnacle of everything is longevity medicine. And so this is, has gone through a lot of different names. Maybe you call it anti-aging, maybe you call it biohacking, whatever you want to call it. And then we can start talking about how do we incorporate some of those techniques into your routine to really supercharge your health journey. And it's so important to recognize that longevity conversation doesn't happen until the end. Okay. If you haven't got your basics right, if you haven't covered your risk of heart attack, neurodegenerative disease, cancer, your metabolic health, and you haven't got your hormone health or your gut health optimized, there's really no reason to start doing some of these advanced longevity technologies. And so that's where we kind of, take people through this journey of all the aspects of health to be complete.
I really want to know, when you're talking about this, Dr. Shah, you're talking about testing for things that we normally don't test for until we have symptoms, right? You're talking about cardiovascular disease and Alzheimer's and cancers. And I don't consider myself a health anxious individual, but just hearing you talk about that makes me a little anxious. So when you have people coming to you, how do you counsel them on, we're going to do these kind of in-depth screenings that you may not have access to anywhere else, but it's being very proactive. And so how do you counsel people on maybe that fear surrounding those tests?
Yeah, it took me a while to recognize, because I'm not a health anxious person myself. So it took me a while to recognize that health anxiety is a real thing and a lot of people have it. And it's a reason a lot of people end up unhealthy, because they just don't want to know, right? And so,
Denial.
yeah, it's denial, right? Exactly.
Yeah.
I don't want to know, right? And so I get it. I absolutely get it. And so what I try to do with my patients is to meet them where they are. I recognize that everyone has a different perspective on what information they want and when they want it and how frequently they want to get it. And it's that same bell-shaped curve that I talk about all the time. In fact, I have a picture of a bell-shaped curve that I bring out. It's laminated whenever I sit down with a patient, and is divided up into 4 quadrants. So you take the bell-shaped curve and it's divided up into 4. And, when you look at a bell-shaped curve, there's the middle, which is most people, and then there's the outliers. And I say, okay, on the amount of blood tests that we do and the amount of health knowledge that you want to receive from me, where do you fall on this? Do you fall like, I don't want to know anything? Or do you fall into, I want to be like, Brian Johnson and have 50 million biomarkers measured every single day? Where
Yeah.
are you on this curve? And I have them point
Crazy.
out where they are on the curve.
Yeah.
Most people will be somewhere in that middle area, but more towards like the right, a little bit towards the right or a little bit towards the left. And that gives me a really good indication on what the pacing is going to be, And so some people, we just start out with what we call the baseline. which is about 25 different biomarkers. Some people, we do more advanced panels. We do full functional medicine panels. And then some people, we go all the way and we're doing full body MRIs, CAT scans of their heart, et cetera, et cetera. And so it really just depends on how much they want to know what the pacing is. What I found with most people that have health anxiety is once they dip their toe in it and they kind of get used to the information, then they go further.
And they feel empowered to make changes, and they probably realize this isn't definitive. We can turn things around just like you did.
Yeah.
And
Yeah,
that's huge.
exactly.
That's very powerful.
Mhm.
Very
I
cool.
think that's a piece of when you first step into functional medicine. I remember, the first time I ran labs on myself and seeing a couple of markers out of range, it's like a kind of a shock. Like, oh wow, I really didn't, realize that, this was off and that was off. And now you do a lab test, you see 5, 10 things out of range. You're like, oh, that's okay. It's just information that, it's to work with. So I feel like your mindset kind of shifts, like you said, as you get more comfortable and in tune there.
Yeah, this was a really powerful revelation for me to recognize health anxiety because I think functional medicine had a problem for a little while because a lot of people, they go to a functional medicine practitioner and you'd ask them like, how was your experience? About half the time people would say, well, they took 1,000,000 tubes of blood for me and then they gave me 1,000,000 supplements and that's all I got from it. And so,
Yeah. Yes.
that's changed now, thankfully, but it shouldn't be that, right? It shouldn't be 1,000,000 tubes of blood and 1,000,000 supplements. And so it's really important to meet people where they are and have that conversation with them about what you're doing and why and how much do they want to do.
Absolutely.
Okay, so now let's jump to longevity. Dr. Shah, I am curious, what are some of the most and least reliable biomarkers you're using to assess longevity?
Okay, so I would say like some of the most reliable ones are going to be the ones that lead to the most problems. And those are hemoglobin A1C and insulin levels to assess for metabolic disease, ApoB and LP little a to assess for cardiac disease, inflammation. So HSCRP, homocysteine levels are really important to me. And then that's kind of where I start people. Um, and then I talk about their hormones. So we measure hormone panels as well, if they're of that age where it's going to be an issue. And then as far as like least reliable markers, there's a lot of new tests out there, things like mitochondrial screening tests and NAD level tests and things like that. I just don't know about the reliability right now. I don't know. Number one, they're not time tested. And so they've only been around for a little while. And so I feel like, I think they need more time before we really know if they are legitimate and if they really make a difference, right? And secondly, I also worry about, the cost. I mean, they're super expensive. And I think that I don't want my patients spending money on things that they could use that money elsewhere better, And so I think the newer tests around mitochondrial screenings and health, I'm a little bit suspect of. It doesn't mean that I'm not going to use them. I think I'm super curious and I like testing markers on people that are, there are a lot of people out there that want everything tested and they want to spend the money on it. And so
Right.
I'm curious about them. I just don't start with them. I think there's still a lot of research that needs to be done around biological age clocks as well.
Mhm.
I'm still, I don't want to say suspect of them. I still haven't got my head wrapped around the accuracy of them.
Mm.
Okay. And so they're evolving rapidly. I think there's newer and newer algorithms and newer testing modalities and thoughts that are being developed around biological age clocks. And even the people that test them now will tell you some of the earlier clocks, and earlier meaning a year or two ago, are not reliable. And so they're learning
Yeah.
themselves
That's
about the reliability of their own
the
clocks.
sense I'm getting too. Mhm.
Yeah, exactly. So
Mhm.
yeah, that's kind of where I stand on testing. I also want to like make a comment about genetic testing.
Yes,
I think
please.
I think genetic testing is important, but not as important as biomarker testing. What I found is that a lot of people would hang their hat on their genetic results to guide their supplement choices, etc. I think it's additive, but I don't think you should start there. As we know, environment and lifestyle plays a much more significant role than your genetics as far as where things are going. But I do use genetics to optimize protocols for people as well.
What about fasting insulin? I don't know if I heard that one.
Absolutely, yeah. So all the biomarkers of metabolic health, I'm really I test on everybody: fasting insulin, triglyceride levels, hemoglobin A1C.
Yeah.
There's a few others as well that we could talk about. But we start with fasting insulin in everybody.
Hmm. Fair enough. Okay, so I want to get into some specific therapies, particularly cryotherapy. I think, people have heard about this. I don't think many people know who is a good candidate. So let's start there. Who's a good candidate for cryotherapy and what's the indication?
With cryotherapy, the way I explain it to people is that you're gonna be really really cold for a few minutes, okay? And so, um, what does that induce in you? It induces a state of kind of emotional shock, and also your body goes into a state of shock, right? But your physiology, specifically your mitochondria, like little states of shock because it
Mm,
encourages them to replenish themselves and to reinvent themselves. And you get what's called mitophagy, and you also have the mitochondria becoming more able to make ATP and make energy for you. And so you do that in small dosages on a frequent basis, and your mitochondria get stronger over time. Also, it feels great. It just, for most people, it feels amazing once you get out. You have energy. A lot of people report sleeping better, myself included. It's a state change, which, a lot of people just having a state change is very beneficial to their mindset. And so it has a lot of benefits you can't really measure. And once again, biomarker wise, it's hard to measure the benefits of cryotherapy. So really, I think that I think it's one of those things that almost everyone's a candidate for it, as long as you can tolerate it and it feels good to you. If it doesn't feel good to you and you've tried it a few times, don't force it. There's other things that you can do to get kind of a similar result.
right.
But that's kind of how I talk about cryotherapy to people.
Do you still recommend cryotherapy or any type of cold therapy to patients or clients who have high stress levels?
Not all the time, no. And so, some people with high stress levels, and they can actually get worsening of their cortisol levels with cryotherapy. Also, I don't recommend it for people with like Raynaud's or some autoimmune conditions. Some autoimmune conditions it really helps though, like rheumatoid arthritis. I don't
Okay.
recommend it for people that have current heart issues, arrhythmias, or have severe blockages in their arteries because it can induce that shock, can induce even a heart attack. We've never seen that happen, but it can. And I also don't recommend it for people that faint easily as well, because the last thing you want is someone to like fall down and faint while they're in cryo by themselves. So there's
Yeah.
quite, and so, at the extremes of age, obviously, we don't recommend it either. Um, it's not for everybody for sure, and you really got to. But if you are a candidate for it, it's worth a try, I would say.
Yeah. I honestly I love the feeling out of it. I just recently started doing cold plunging instead of the cryo chambers, but do you have the cryo chambers at your clinic? Is it air or is it water
Yeah, so we have a
chambers?
air cryotherapy chambers, and I have a cold plunge at home. I can tell you the cryotherapy chamber is so much more comfortable than getting into
It
cold
is.
water.
That was my
I
question.
agree.
It's much more comfortable than getting into cold water. So, yeah, I like going in and getting the cryo when I go to NexHealth, but for daily routine use, I use my cold plunge.
Mm.
So the concept is the same. I mean, it's cold therapy, whether it's water or air.
Yeah, I don't think there's any good science around how cold it should be. I don't think
Mm.
there's any good science about how long you should be in it. Um, I know, there's been tons of podcast episodes around these things, but they're not big studies and they're definitely not definitive. And so I think you have to see what works for you.
Okay, so what about so IV therapy is really popular right now. I feel like clinics are popping up all over. Sometimes it's hard to know if we can trust one IV clinic over another. So I'm curious about what should a patient look for in an IV clinic?
Yeah, great
What are
question.
some
Okay,
red flags?
number one, whenever you're putting something into your veins, you have to be so careful. This is not something that should be done without some level of concern. Okay. And so Number one, you want to make sure whoever's doing an IV on you has a ton of experience and is licensed to do that IV. Okay, and so make sure that the person putting the IV is licensed. I would say, you can get a visual feeling for how clean a place
Mhm.
is. You should use your spidey sense on the facilities as well. If it doesn't look like the kind of place that you should be putting an IV in, don't do it there, right?
Yep.
Thirdly, I would say, all of our NexHealth clinics are medical clinics, and what I mean by that is they are under my medical license, and so they are. Um, we're held to a certain standard of IV therapy. Um, and I have to make sure that not just it's a clean facility, but also the places that we source our ingredients are reputable. And we actually have a pharmacist that comes in and does a survey of all of our facilities every 6 months. And so and it's an independent pharmacist that comes in to make sure that the facility is clean and also the products are clean and beneficial. And also, we're following all of the processes correctly. And, IV therapy has been used in hospitals, obviously, for decades and decades. There's very well defined processes for how you do IV therapy correctly. One of them is when you're mixing an IV, it has to be done under a special hood.
Mhm.
If you don't see this special hood, IV therapy mixing hood, you can Google that. Um, at the facility, chances are you shouldn't be doing an IV there, And so these are all really important things to look out for.
Good tips, yes. Okay, so
Mhm.
let's talk about IV therapy specifics. What is your favorite IV therapy for longevity at this point?
I think that the way I look at IV therapy is that you're getting a micronutrient infusion, right?
Mhm.
And one of the things that really impacts our longevity is a lack of micronutrients. Okay. And so, unfortunately, our diets right now, and you both know this, are very devoid of appropriate levels of micronutrients for many reasons. One of them being that a lot of us survive on ultra processed food. A lot of people survive on ultra processed food. Ultra processed food is not nutritionally dense at all. And so, this is why we see tons of micronutrient deficiencies in our patients. But even if you have a good diet, we know that our food has nowhere near the nutritional value that it used to 50 to 80 years ago, right? And so there's a lot of reasons for that: over farming of our soil, genetically modified crops, etc. So we're just not getting the level of nutrition our body needs. The other big problem is we live in one of the most toxic environments ever in human history. So every cell is fighting for its life every single day, all day long, and it needs nutrients to do that, right? And so I look at IV therapy in general as providing our cells with the micronutrients that they need to do their job because they're working really, really hard for us right now. And so I would say that we use, all the traditional micronutrients in our IV, all the traditional B vitamins, C vitamins. We use, we even give people shots of the fat soluble vitamins like D, vitamin D, CoQ10, etc. Because our body needs them. And so I don't really have a favorite. I just do our standard Myers cocktail.
Mhm.
We do add some additional vitamins to our Myers cocktail. And then we also do intramuscular shots of fat soluble vitamins as well.
I have to
Right.
ask about NAD just because of how popular it's been. I know you can do the NAD IVs, and I've also seen like the daily injections as well. So what is that doing for us?
I'm so glad you reminded me of that,
Mm.
Melissa, because one IV I do add on is NAD IV. And
Mhm.
specifically, I use nicotinamide riboside, which has just come out in IV form by a company called True Niagen or Chromadex. And I
Oh,
like that one a lot because if you're familiar with IV NAD therapy, it's not very comfortable. It makes your chest feel like it's tight. A lot of people get
Mm.
nauseous during it. And so you have to really turn down the IV infusion rate, and it takes a few hours to do it. Well, with nicotinamide riboside, it actually gets directly absorbed into your cells so much faster. And so you could do it. Number one, is much more comfortable, but number two, it's also a lot faster to do it because it's so comfortable. And so I add IV nicotinamide riboside to my IV therapy sessions all the time. One other thing I do as well is glutathione after my IV as an antioxidant, and that's kind of like my combo. Yeah.
The
Um,
ultimate, yeah. That
yeah,
sounds amazing.
exactly.
So I do want to shift over into hormones because we kind of mentioned a little bit earlier. That's kind of one of our pillars that we focus on when we think of longevity and health optimization. So what patterns are you seeing in terms of hormone imbalances and how can we optimize hormone health as we age?
Yeah. So, we're very proactive about testing testosterone and estrogen levels in our men and our women. We also measure, of course, free testosterone, and we're measuring steroid hormone binding globulins. We're doing a pretty complete panel on our patients. And what we're finding is almost 80 to 90% of people don't have optimal levels, unfortunately. And this is even at younger and younger ages, we're seeing
Mhm.
this. And so I think it's really important to be really proactive about measuring your hormones and then doing lifestyle interventions to help optimize your hormonal patterns. We're also big believers in hormone replacement therapy. It's gotten a really bad, um, uh, unfounded rap over the last 50 years of research due to bad science that was misinterpreted. But I think we're at a point in time now that we are really able to do it right and really help people to prevent chronic disease and also just to feel great. So, yeah, that's kind of the big picture where we're at with hormone replacement therapy.
So I'm wondering on that note, Dr. Shaw, would you say most people could benefit from bioidentical hormone replacement therapy?
I don't know if it's most people. I definitely think it's a lot more that are getting it right now.
Mm,
I think there are a lot of people that aren't good candidates for it as well. And so you really have to work with a really skilled practitioner that
yes.
understands the risks and the benefits and your specific situation. And I do think there's a lot of people suffering out there that hormone replacement therapy could really benefit them. Once again, I do think it's one of those things that if you don't have your nutrition and your exercise and your, detoxification and your sleep right, you have to get those things right first to see how that affects your hormone milieu. I do think, when women go through menopause and men go through menopause, it's a good time to start considering it because there's a synergistic kind of effect between hormone replacement therapy and also exercise and nutrition
Hmm.
and sleep, where if you're suffering with disordered hormone levels, sometimes it's hard to get good sleep. Sometimes it's hard to maintain your muscle mass and reduce fat, right? And so they work together really well when you're at that age.
What about alternative options? Maybe you have a woman with a past history of breast cancer. She's just nervous. She doesn't want to go there, right? What are some alternative, maybe nutraceuticals or herbals that you're weaving into lifestyle modification as an
Yeah,
alternative
so
for
so
hormone?
so there's a lot of them, right? And depends on what the woman is specifically suffering from.
Yeah.
For example, ashwagandha is one that we can use. We can, if they're suffering from low energy, we can use compounds like NAD. We can use urolithin A as
Mm.
well to improve their energy levels. Um, if they're suffering from like headaches and migraines, we can use magnesium supplements. There's a lot of different things that we can do depending on what the symptomatology is.
I have to ask about urolithin A because I don't think we've ever touched on that on the podcast, and I'm hearing more and more about it. What is it? What is it used for? Why do you like it?
Yeah, yeah. Urolithin A is a compound that your gut makes when you eat certain fruits and vegetables. Specifically, pomegranates are really good at creating urolithin A.
Hmm.
However, there's about somewhere between 50 to 80% of people that can't make urolithin A,
Ah.
no matter what. And so you can take it as a supplement form. And what it does is something pretty incredible. It increases the number of mitochondria that you have, it increases their efficacy. And so we all know mitochondria are the powerhouses of our cells. But what does that really mean when you have more mitochondria that can work really well? Every cell can do its job better, and therefore brain fog goes away. You have more energy, your gym workouts are better. You can sleep better. All these things, all these physiological functions get better. You can detox better, all of it. So it really does address one of the root causes of disease and aging, which is mitochondrial dysfunction.
Mm.
And so I'm a big fan of urolithin A as one of those supplements that you should consider.
You said 50 to 80% of people can't produce it. Did I hear that right? So
Yeah,
that's a majority of people
a lot of
aren't producing
people,
this. Wow.
right? Exactly. Yeah.
So you might as well just try it. There's no sense in trying to identify those individuals, right? I imagine Dr. Shaw try it
Yeah,
as a
it's really
supplement. It's
difficult.
really low risk. I
Yeah.
mean,
Mhm. Yeah,
mhm.
there's really no risks to it that I can see. And so I would say is give it a shot. And if you like it and you feel better, continue it. I think for a lot of people, supplements is like, it's like a Pandora's box. People get really
Mhm.
confused. They get a paralysis by overanalysis about what to take. And so once again, I whip out that laminated sheet of, where do you fall on the bell-shaped curve? Like, are you completely against supplements no matter what I tell you? Or do you want to take everything that Mark Hyman, Brian Johnson, and, three other biohackers recommend?
Combined.
Exactly. Combined. You'll be surprised how many people want to do that, by the way.
Oh gosh.
I can
There's people that are proud of their supplement boxes they carry around, their bags of supplements they carry around with them. And look, I get it, like you want to do everything you can do. But I do think that urolithin A is falling more towards one of those foundational supplements, especially as we age.
I love that. Foundational supplements, and then also it bears repeating paralysis by overanalysis.
Yes.
That rings true for so many of us. And we had
Yes.
another provider on. She said, we're living in an infodemic. And that's so
I
true.
love
It's
that.
just, yeah,
An
how do we guide
infodemic.
our patients through this infodemic?
Yeah.
Well,
One of the tools I use, and I talk to my patients about this all the time, about the infodemic, is the Pareto principle. There's really 20% of the information that's going to move the needle, 80% for
mm,
you. You got to do those things first. You got to do the big rocks first. Focus on the Pareto principle, get those in place, and then start going down the rabbit hole.
and that's the foundational stuff, right? You're talking about the sleep, our exercise, our nutrient dense diet.
Well, in each category, I would say there's some foundational stuff. Like
Mhm.
for exercise, for example, I always tell people, like, obviously it's good to go to the gym and exercise, but don't worry about, what your VO2 max is and your
Mhm.
your HRV if you're sedentary all day long. Like the
Mm.
big rock is to not be sedentary. You got to
Right.
figure out how not to be sitting more than 4 hours a day because that is a massive hit on your mortality rate. For every 10% of time you spend sedentary over 4 hours, it's a 15% increase in your rate of mortality. And so being really attacking sedentary behavior is one of the big rocks in the Pareto principle that's really going to move the needle. And then we can start like really honing in your exercise routine.
What do you like to see from people who maybe work a desk job where they are, required to be on the computer like 8, 9 hours a day?
Yeah.
I would say probably a majority of people who have that kind of lifestyle, maybe even us
We
included. But
selfishly need to know.
yeah, I mean, I've done the whole standing desk and treadmill under the desk thing,
Exercise
but
snacks. I like
yeah.
that term.
Yeah. Yeah.
Yeah, what do you like to see your patients doing?
I buy them all an egg timer.
Oh, a timer?
I buy them all an egg timer. It looks
Okay.
like a little silver egg. And
Okay.
they turn it to 45 minutes and it goes off really loudly and it's super annoying. But every 45 minutes, they shut their laptop screen and they get up and they walk around or they do like an exercise snack that,
Mhm.
that Emmie was referring to. I think initially it's really good just to get into that routine of every 45 minutes to get up and just move. Just get up out of your chair, move, go to get a cup of coffee, go talk to somebody in the
Yeah.
office. Not only does it break up the sedentary behavior, but it also breaks up that stress level, creating a cortisol release, right? Because it takes time for mental stress to become physiological stress and cause a cortisol release. And usually about every 30 to 45 minutes is about the right amount of time to break up the stress.
Mm.
And then once I get them doing that, then I add in the exercise snacks. We try to do them along mobility and also strength. We have people buy dumbbells and keep them under their desk. Walking desks are a really good item. I walk on my desk every single day when I'm at work for about 5, 6 hours. I get about 30 to 40,000 steps in. No one,
Amazing. 30
yeah,
to 40,000.
yeah.
Wow.
Some days I get 30,000 steps in. It's crazy.
Yeah.
But I think that's probably a little bit too much. I mean, aiming for 10,000 steps is probably a good idea. Minimum being somewhere between 7 to 8,000, I think is a good idea. But walking desks are fantastic.
Good, all good stuff. Okay, so
Yeah.
let's talk a little bit more about specific therapies. I'd love to know your take on therapeutic plasma exchange, also known as plasmapheresis for longevity.
Yes. So we're doing therapeutic plasma exchange, plasmapheresis at our clinics. And Well, let me take a step back. Let me talk about what it is first. So, therapeutic plasma exchange is a treatment that we've had available in the hospital for decades now. It's
Mm,
FDA approved. We've only used it for emergency situations when people have autoimmune crisis or they have like a medical toxicity of a medication. Because what it does is it removes your plasma from your bloodstream. And the way it does that is we have a patient sitting there in a chair. We put an IV in each arm and we remove blood from one arm. We put it in this machine that is basically a giant centrifuge. So if you've ever seen PRP, when you centrifuge blood, it separates into this yellow stuff up top called plasma and red stuff on the bottom, which are your blood cells. We reinfuse the blood cells with the albumin, which is a protein, and we take their plasma, all of their plasma, one plasma volume, so about 3 liters of plasma, and we throw it away, basically. The reason we do that is because in our plasma lives toxins, lives high cholesterol levels, lives a lot of inflammatory cytokines, also lives immune complexes. Lots of things live in the plasma that your body is trying to detoxify you from.
mm,
And sometimes your body just can't catch up. And so, what the plasma exchange does is a lot of people call it like an oil change for your body. But I look at it as giving your body a breather for a few weeks from catching up with a
mm,
large amount of toxins that have been built up in your bloodstream. And we're seeing tremendous results with it. I mean, there's research being done in San Francisco around how it slows the dementia with Alzheimer's. So it actually prevents dementia with Alzheimer's. We've known you can use it for autoimmune crisis, but when you use it for people that have just autoimmune disease, we're seeing that they can take less medication and less frequently. What we see with people with a lot of inflammation is it reduces inflammation. And now what we're doing with the Vibrant America urine toxin test is we're measuring all the toxins before and after plasma exchange. All of them universally are decreasing, whether it's mold, whether it's heavy metal, whether it's, BPAs, all of them are decreasing. And it's different for different people about how much they decrease, but it does give your body a chance to catch up. And so we're really excited about the research being done around it. We're doing a lot of research around it ourselves in our clinic. And I think it could be a really good tool in our toolbox that is universal in its application. So you can use it for a lot of different things at the same time. And what's great about it is we're not giving you a medication, right?
mm.
We're just helping your body catch up with what it's doing. And so it's really safe as well.
Real quick, how many sessions are you recommending for detoxification?
It completely depends on each individual. And so we see some people detox fast. We see some people it takes them longer. It also depends on their level of exposure. So are they out of that house that is, mold everywhere or not? Right. And so those are the kind of things that we're looking at. And we're really individualizing the protocol based on the individual.
Hmm. And Dr. Shah, I know we're running a little bit over the hour here, but I do want to squeeze in just one last question before we wrap. If there are 3 daily habits that we can leave our listeners with that you would want to see everyone practicing for boosting health span and longevity, what would they be?
Okay, number one is get into a morning routine. Even if you're not a morning person, you want to set your day off in the right path. And my morning routine and what I recommend for my patients is it's not just physical. We all know that we should go outside, get some morning sunlight, set our circadian rhythms, but it's also mindset. Getting your mindset in the right direction first thing when you wake up is not looking at your phone and starting to scroll social media or your emails. It's the exact opposite of that. It's leaving your phone away from you. I get all my patients to try to charge their phone in a different room. We're all so used to charging our phone at our bedside that I think it's a real problem, And so we get our clients to start developing a mindset routine around gratitude, around kind of calming their mind if they're in a state of, I think a lot of people wake up in a state of like high cortisol release and just anxiety sometimes, in fact, for the day. To get them to calm their mind, to do some visualization exercises. I think all of those things are really important. We use a 5-minute journal. Have you ever seen that on Amazon? It's
Yeah.
called 5-minute journal. Yeah. So I like to buy that for clients. And then, adding in some level of physical movement. Dr. Rangan Chatterjee, who's another health influencer doctor, he taught me about the 5-minute workout, which I think is fantastic. Just doing a 5-minute physical activity in the morning, a workout is going to get your body moving. And I think that's super important, especially if it's a workout that involves a little bit of mobility. And then lastly, I would say in the morning routine that I do is I can actually, I'm lucky enough that I can now, my kids are a little bit older and they sleep and I have a little bit more time. So I can do 30 to 45 minutes of reading. And I have 2 books. I have one book around mindset and one book around health that I like to read. And I just read a few pages out of each one of these 2 books, one for my mindset and one to learn something about what I'm speaking to you about, health, wellness, longevity, etc. And that reading really, first thing in the morning when your brain is the most receptive to information, can really be powerful, especially if you do it day after day, week after week, month after month. I think learning is the most powerful tool that we have for our health and wellness. And so I like to incorporate that on a daily basis.
I love that. It's such a powerful way to start our day and to keep the momentum going. Because if you start strong, you're going to end strong, most likely.
Exactly.
I love that.
Exactly.
Well, Dr. Shah, thank you so much for sharing so much. I could probably ask you questions for the rest of the evening. You are such a potent resource of knowledge and experience, and the business that you have created and grown is just beautiful and phenomenal. And we love your philosophy. And if any of our listeners want to connect with you online, maybe they want to check out a NexHealth center near them, where can we find you?
Yeah. So NexHealth is at next.health, www.next.health. And I'm on social media at Darshan Shah, MD. And then my website is drshah.com.
Awesome. Thank you so much again for taking the time to come back on the show today. And we'll link these down in the show notes for you guys so you can locate Dr. Shah online. And until next week, wishing us all vibrant health and wellness.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.